All right, 2025 is kicking off with a warning from the Centers for Disease Control about growing cases of norovirus.
Yeah, there's been a surge in this extreme stomach virus since the beginning of December, and given that many of us have just returned from large family gatherings and celebrations, we invited Dr. Eric Asher from Lenox Hill Hospital to help us stay healthy. So good morning to you, Dr. Asher. Great to have you here and healthy.
Thank you. Good morning. Good morning.
Happy New Year to you.
You as well.
First, let's talk about norovirus. What is the difference between norovirus and the stomach flu?
So norovirus is another name for the stomach flu.
Okay.
Sometimes we hear it's stomach bug, 24-hour stomach virus. It's all the same. It's the most common cause of stomach bug, and it is extremely contagious.
Okay.
How easily can this thing go from one person to another?
It is very easy, unfortunately. It could be caught from shared surfaces, so thinking holiday parties, sharing utensils, trying somebody's food or beverage, shaking a hand. It could be also caught from running into the bathroom after somebody else had it and breathing in the particles. Oh. So it's everywhere. It's everywhere.
Oh my gosh. So what is the best preventative measure that we can take?
Hand washing is super important.
Okay.
You want to make sure that you're washing with soap and water at least 20-25 seconds under the sink with warm water. Hand sanitizer, unfortunately, does not do a good job.
It does not.
Does not do a good job. Alcohol-based hand sanitizers are good for most viruses, but norovirus is unfortunately not one of them.
Wow.
And with the soap, I know sometimes people have their like herbal, different soaps. We need antibacterial for stuff like this, right?
Any good soap is fine. The norovirus is a virus, so the antibacterial soap isn't going to make a huge difference. So any soap that you have is good. It's really about just hand washing before you're going to eat, before you're going to prepare food, and especially after touching a shared surface.
And have you started to see, or have you been seeing great numbers of norovirus? Since Thanksgiving, really?
Yeah, we typically expect to see it late fall, so around that November Thanksgiving time, and it usually surges through April.
Through April?
Through April. It starts to have a downward curve after the winter. We expect, with more gatherings, more indoor gatherings particularly, we do see it tend to go on the rise.
But children through adults?
It's everyone, children and through adults. The younger you are and over the age of 75, the more susceptible you are to a severe case of it, but it's usually self-limiting.
Yeah, and our kids are going back to school today. A lot of them are. So what would you tell our parents and child care providers, et cetera, on how we can prevent this?
Of course. So if somebody's not feeling well, it's best to stay in because you don't want to infect other people. It does spread very quickly. Reminding about good hygiene is very important. Washing hands, not sharing food or drink, not sharing toys, things of that sort.
Okay.
Two questions for you, kind of back to back here. Is this a virus you can pass without knowing you have it? And can you get in front of it with like vitamins or probiotics or anything like that?
Vitamins and probiotics are great, but unfortunately, if you're going to come in contact with it, you will get it. And you could start sharing norovirus 2 days before you're actually exhibiting symptoms.
Oh, no.
Yeah, so it's very important to make sure that if you're ill or you're starting to feel that way, you stay in, you're disinfecting shared surfaces, and you're not sharing food or drink.
If someone in your family, in your home, has norovirus, is it safe to assume you're next and just go ahead and make the appropriate steps to go forward?
It spreads very quickly, so we do see it, especially with folks who are living in the same quarters. They are likely to get it. But if you're not, you shouldn't be in the kitchen preparing food if you're ill. You shouldn't be touching shared surfaces for 2 days after your symptoms start to resolve, and that's your best line of defense.
And what are those symptoms then specifically?
So it's usually nausea, vomiting, diarrhea, stomach upset, stomach cramping, but it also could be fevers and most commonly that extreme fatigue.
And then when we talk about norovirus, which is basically, like you said, stomach bug, but as we get deeper into this winter, are you expecting RSV cases, COVID cases to go up too?
Unfortunately, we're seeing all of the viruses on the rise, the RSV, the COVID, the flu, as well as the norovirus. So hand washing is so important.
I recall, I think there were cases where people had a 1-2 punch of more than one of these viruses at once. What do you do? What can you do if you have one thing come down? Do you kind of like quarantine yourself to kind of prevent the next thing from taking advantage of your weakened state?
Yeah, absolutely. When your body's already ill with one virus, your immune system's already a little bit weak. So best to stay very hydrated. Vitamins and minerals, as you mentioned, are going to be very important during this time period. And just trying to rest it out.
Yeah.
Rest up.
I mean, we're deep into the flu season. Is it too late to get a flu shot, or can we still do it?
It is never too late to get a flu shot. It is never too late to get a COVID vaccine. If you're of age for the RSV vaccine, vaccinations are our best line of defense.